Hello, hello. Happy Tuesday, everyone. Happy Tuesday, happy Tuesday, happy Tuesday. Come on in. Yes, we're going live with Whitman-Walker today on Tuesday. We are going to go live today. We are talking about the COVID-19 Delta variant that most of you have been hearing about. So come on in, come on in. Got some information for you guys today, so come on in, come on in. Normally I go on Thursdays, but we are going on today, Tuesday. Just gonna wait a little second, guys. We're gonna get started. Come on in. Hope everyone's having a great day. Talking about COVID-19, the Delta variant. So if you've heard about it, great. If not, I'm gonna give you guys some information on that today. So don't leave if you want to know a little bit about it. And we will talk about it today with Whitman-Walker. So for those of you that don't know, I am an influencer with the Whitman-Walker Health Clinic. We talk about various subjects, especially during this pandemic, COVID, being safe sex, getting tested. So today, pretty much, we're going to be talking about the COVID-19 Delta variant. So stay tuned, stay tuned. Just waiting for our guests to come in. Give me 1 second, y'all. Let's see. Oh, I see you. Sorry, it was not letting me get it. There it is. Let me see if it works. Hello, hello, everyone. Come on in, come on in. Let me know if you got the request. It made me send it back. I don't think it was picking it up. Hello, hello, hello. Come on in, guys. Hey, how's it going?
What is up, Orlando?
Happy Tuesday.
Happy day.
Well, come on in, guys. Like I said earlier, I'm a social media influencer with the Whitman-Walker Health Clinic. We talk about different subjects, recently mostly about the pandemic, COVID-19. Today we're going to talk specifically about COVID-19, the Delta variant. I know some of you have heard about it. So come on in, come on in. If you have any questions, please ask them inside of the chat, or you can DM Whitman-Walker or myself, and we'll get you any information. So welcome to my talks with Whitman-Walker. I've been working with them for a little bit over a year. So we've definitely been having different conversations on safe sex, testing, vaccinated, things going on with your COVID-19 test and vaccinations. Today we're going to talk about the new variant Delta. So like I said earlier, if you need to chime in, ask some questions, and I'll try to get to you. If I can't, we will DM you, or you can DM us as well. So as many of you know, the first cases of SARS-CoV-2, which is a Delta variant, were pretty much detected in the United Kingdom mid-April, just about the time the nation was getting ready to open up. The COVID-19 case numbers, hospitalizations, and deaths were plummeting. Thanks to months of lockdown and one of the world's fastest vaccination programmers, 2 months later, the variant, which was first detected in India, has caused, the UK wave and forced the government to delay opening up society that it had originally planned for June 21st. That was pretty much about a week and a half ago. So it's crazy. Everything was trying to get back to normal, and then bam, Delta comes in, and it just is getting us all riled up. So, be super ready to get information. I'm sure it's going to be coming from all angles. So pretty much we got some information that we just received. So I'm here to share that with you. So after observing the shocking swift rise of the Delta variant in the United Kingdom, other countries were waiting to see what kind of impact it will have on them if they aren't already being affected by it. Because we hear some things from outside of the U.S., but we don't hear everything. So sometimes I know a lot of countries, maybe don't share as much, or we just don't get that information on a daily. But nations with ample access to the vaccine, such as those in Europe um, and North America, are hopeful that shots can dampen the inevitable rise of Delta. But in countries without large vaccination stocks, particularly like Africa, um, are going to be some places that the variant could be very devastating at. So pretty much, what that's telling us is if the vaccination has been successful in getting most of their population vaccinated, it could help kind of reduce what's going to happen, as opposed to those people who are not getting vaccinated, that Delta variant, which is a little more aggressive, is going to be a little more hard to defeat as the first round of COVID-19 was. So, for example, today in the New York Times, there was an article about concerns about the Delta variant triggering lockdowns, especially in Asia and Pacific countries, most of who were scrambling to slow the spread of the more infectious variant. So they have been putting restrictions back. They've put stay-at-home orders just when they were beginning to open back up. That's super crazy. And even in Australia, outbreaks have forced 4 major cities to go back into strict lockdowns. So that's super, super crazy. WHO stands for the World Health Organization. They're super concerned about the Delta variant since it's spread to at least 85 countries since it was first identified in India, which is now responsible for 1 in 5 cases across the US. So 1 in 5 people just about are getting that Delta variant as opposed to the regular COVID-19 we've been seeing around. Let's see. So Delta, also known as B1617.2, grew rapidly in some parts of the country and showed signs of partial resistance to the vaccine. But it was difficult for researchers to kind of figure out what kind of properties in the variant of the Delta were the factors that were driving all these confirmed cases, which were pretty much 400,000 per day, especially mostly in these mass gatherings that people are starting to get more comfortable and come out. So Delta is moderately resistant to the vaccines, particularly in people who have received a single dose. Research from May 22nd found that a single dose of either AstraZeneca or Pfizer have reduced a person's risk of developing COVID-19 symptoms caused by the Delta variant by 33%, as opposed to the 50% for the normal Alpha COVID variant. And a second dose of AstraZeneca vaccine boosted protection against Delta to 60% compared to the 60% against Alpha normal COVID-19. While 2 doses of Pfizer jabs were 88% effective compared to the 93% against the Alpha COVID-19. So although there has been no formal test on the Moderna completed so far, it looks like the Moderna will be a very effective to protect against the variant as well. Hold on, guys. Give me 1 second. I didn't even notice I lost you. I didn't even notice I lost you, but we are getting Whitman-Walker back in here, so give me a second. So yeah, guys, if you have any questions or any little things you want to join in and tell me, please come on in. Don't be shy. Exactly. Thank you. So guys, there's little posts coming up of what I'm saying. So if you miss it, snap it. If you can't hear me, take those little snaps, and we will post this video right after. So you can always watch it here, or you can watch it on my page, or you can watch it on Whitman-Walker's page as well. Give me a second. There we go. Welcome back.
Sorry.
I was all up into my paper. I was like, I didn't even notice you left me.
Keep going.
All right. So as I was saying, so a lot of these vaccinations are super helpful, although it may be lower than the normal effect that it has compared to the regular COVID-19. It's still super helpful. So make sure, like we talked about earlier, if you haven't gotten vaccinated, get your appointments. There's a lot of on-sites, walk-ons to get your vaccination. They feel like the more population is covered by the vaccinations, the less it can actually affect such a large area, especially here in the U.S., that most states are actually getting a lot of vaccinations compared to others. So we're going to hit that topic as well. So evidence from England and Scotland suggests that people infected with Delta are about twice as likely to end up in the hospital compared with those that were infected with Alpha, which is a normal COVID-19. Cases of Delta variant in the UK are doubling roughly every 11 days. That countries with ample vaccine stocks should be reassured by the slower uptick in the hospital admissions. Recent studies found out that people who have had at least one vaccine dose are 75% less likely to be hospitalized compared to the unvaccinated individuals, and those who are fully protected by the 94% are less likely to be hospitalized. So Delta is also on the rise here in the US. So particularly in the Midwest and the Southeast, the CDC and the prevention declared it as a very concern on June 15th. That was just about 2 weeks ago. But patchy surveillance means that the picture is pretty less clear. According to the nationwide sampling conducted by genomics company Helix and San Mateo, California, Delta is rising fast. So using a rapid test, the company has found that the protection of cases caused by Alpha fell from more than 70% in late April to around 42% as of mid-June, with the rise of Delta driving much of that shift. Let's see if anybody has any questions. Come on in, guys. Ask any questions you want to ask or just say hello. Let's see. Hellos, questions. Good. All right, perfect. So guys, if you're just joining in, we're talking about the Delta variant that has been uprising all over the world. Okay, so it's expected that Delta to eventually become very dominant in the United States, but to be somewhat blunted by vaccinations. However, vast disparities in vaccination rates could lead to regional and local variations in cases, hospitalizations caused by Delta. So 70% of eligible New Yorkers have received at least one dose of vaccine, a milestone that triggered the lifting of most COVID-19 restrictions last week. But that figure is below about 40% in some parts of the state. Communities with high proportions of African and Hispanic individuals, where the vaccine rates tend to be low, could be especially hard hit by Delta. These populations are really at risk of localized outbreak from Delta. So I think it's really important to still keep track and watch all the information that is coming out as much as possible. Data from Helix on nearly 20,000 sample sequence since April suggests that the Delta variant is spreading faster in the U.S. counties where less than 30% of residents have been fully vaccinated compared to the counties with vaccination rates that are above the threshold. So Delta poses a big risk. Scientists are saying that to continue to have limited access to vaccines, particularly those in Africa where most nations have vaccinated only less than 5% of the population, most likely there's going to be more of an impact there. In some African countries, it's extremely limited to get your vaccination, but there are hints that the variant is already causing cases to surge. Several sequences of the variant have been reported in the Democratic Republic of the Congo, where the outbreak in the capital city of Kinshasa has filled all the hospitals, and where the variant has also been detected in Malawi, Uganda, and South Africa. So pretty much these countries have any country that have close economical links to India, such as those as East Africa, are probably at the greatest risk of seeing a surge in cases caused by Delta. So we know that a lot of these places who aren't getting enough vaccinations, they're not getting a lot of research, they're going to be, well, at least we're thinking they're going to get hit pretty hard. So similar factors could be keeping Delta at bay. For example, in Brazil, which is battling another immune-evading variant called P1 or Gamma, which is another variant of Delta in that country. So while countries grid themselves against Delta variant, or hope that it passes them by, researchers are saying that they need to watch for even greater threats. So if we start to see more variants that can really challenge what's going on right now with the vaccines and how the vaccines are dealing with what we know. So guys, you gotta stay put, you gotta stay up to date, you gotta stay super in the now, in the know, to see what's going on, to see, make sure you get vaccinated, to try and avoid as much as you can ending up in the hospital, or who knows what the outcome could be right now. But like I said earlier, if you have any questions or concerns, please hit us up. You can hit us up on the Whitman-Walker page. You can hit us up here. You can hit us up on Facebook, on Twitter, and you can always go to our website, www.whitman-walker.org, about getting, tested for STIs, HIV. Also, if you need to get a vaccine, please email or call us so we can get you that information. Phone number is 202-797-4439. And don't forget that we are still here with COVID-19 pandemic. So if you want to get vaccinated, there are a dozen or so walk-up sites throughout DC where you don't need an appointment. You can just go get your vaccine. If you do want to get your vaccine through Whitman-Walker, like I said earlier, you can call us at 202-207-2480 or email appointments@whitman-walker.org to schedule an appointment. We'll be registering people as well at any of our outreach events. So if you do see Whitman-Walker out doing some outreach, talk to them about getting an appointment, or you can always email us or go to the website. If you've already gotten vaccinated, you know the deal. The CDC has given you the okay to relax with some of your mask wearing and return to some pre-pandemic activities. However, like we were talking about earlier, wear your mask. If you feel that you're somewhere you're not really sure about who's vaccinated, who isn't, put your mask on, keep your 6 feet distance. You already have those rules put in place. We were using them for so long that it should already be something normal, all right? The vaccine isn't 100% effective, and there are no protocols in place to actually verify who is vaccinated, so you've already gotten used to that. If you haven't been vaccinated, please continue your CDC guidelines, wear your mask, quarantine, social distancing, and it's very important to get the vaccine. Discuss the COVID-19 measures with your doctor and be mindful of mask and keeping your distance, especially when you're around somebody you don't know have been vaccinated. And like I said, don't forget to follow us on Instagram, Facebook, Twitter. If you have any questions, hit us up in the DMs at Whitman-Walker. And if you missed the video, you can watch it on my page right after. And you also can watch it on the Whitman-Walker's page. So we appreciate you. We see you. And don't forget to follow our sister pages, Real Talk DC, No Filter DC, and The Corner DC. Hope to see you guys soon. Stay tuned for more topics on what we're going to be talking about with Whitman-Walker. If you want to talk about a specific topic, hit us up, and we can see if we can make that happen. We appreciate you. We see you. Till next time. Thank you, Brendan.
Bye, everyone.